This is the another view positioning in positioning terminology, semi-recumbent. So semi-recumbent it will be taken in portable radiography, or sometime patient comes with the trolley. We not able to take a patient with the erect or sitting any positioning. That time we will take it in the trolley itself only. So that's it's not prone, it is not erect or not sitting positioning, is semi. So we will take it sometime when we want to see any fluid level or anything. That time we will take it this positioning. Next, till now what I explained, that is positioning terminology, which I am further slides I am going to explain about projection terminology. See, positioning terminology means is related to patient, how we will ask the patient to lie down, supine, prone, lateral, erect. This is all positioning terminology. Project terminology means the patient is touching to the cassette, anterior or posterior part is touching to the cassette. This all it comes under the projection terminology, which are the rays, X-ray, if it is passing through the, say now example here anterior posterior projection terminology. The central ray which is passing through the anterior, and through posterior side it will exit, entering to the anterior and exiting through the posterior. So that is called a anterior posterior view. Okay, that's what anterior posterior view. When it comes to the posterior anterior, this is vice versa of the anterior posterior view. So here in this posterior anterior part, usually it will be touched to the cassette. Cassette will be here. The rays, X-rays pass through the posterior to anterior and it will reach to the cassette. So that is posterior anterior view, or also called PA view. Now another one view, that lateral projection. So lateral projection, where you can see previously I mentioned, if rays, X-rays passing through the one side of the patient to emerging or originating exiting through the another side of the patient, that is called the lateral view. In lateral view also there will be right and left lateral view. Here in example it is given. See, this is cassette or image receptor means cassette. If it is there in the right side of the patient means this is right lateral. If the cassette is the left side and X-ray tube is the right side, it means left lateral view. So this is the lateral aspect of the patient. There are certain other projection terminology also we use. APPA lateral is a common view. Patient, if it is stable, where a patient comes with the walkable, those kind of time we will be able to take those all three radiography. Sometime what will happen, patient will come with the not able to move, patient will be lying down. Now you wanted to take a lateral. See, this is the example view for the lateral radiography, left lateral radiography. So previously I told left lateral or right lateral, anything can be. Now example, patient comes with the lumbar spine X-ray or chest down, you take it as a chest radiography. Patient lying down, you can take AB view, no problem. But you want to take left view also of the chest. So that time what you can do, you can take a left lateral. This is the patient is lying down in supine positioning. This is we also called a dorsal decubitus. So here the one side of the patient, the cassette will be kept. You can see this is the vertical bucky is kept here in the left side of the patient, and the X-rays pass through the right side and it will emerge through the left side of the patient body. Now we will, when the X-rays come, when the radiography image comes, we will get the left lateral view of the chest. So this is left lateral view. See, this is another view. This is, you can see the same time how I given an example previously. Sometimes you want to take a PA view, but patient not able to not able to sit, not able to stand. So that time you want to take a posterior anterior view means. So these are the which I explained previously, left lateral, the dorsal decubitus, and also this one PA decubitus. Left, this is left lateral decubitus we also call. You can see left side of the patient is touching on the table. So these all views we take when suspected fluid level, pneumothorax or hemothorax. If it is such any cases is there means these two views will be taken. In a further next projection just views I will explain about that. See, now here you see this cassette is kept. Cassette is anterior here, anterior to the patient. Cassette, which X-rays will pass through posterior to anterior. When we get the radiography, we will get a PA view, but patient will be lying down in one side. So that's what it is called, left lateral decubitus. Okay. So what are the positioning, and here in the slides, direction and centering ray and all is written. So that's not right now at present. I will explain in some other next classes. This is the angulation. See, patient is lying down in supine positioning. Sometimes we need to give caudal angulation or cranial angulation. Sometimes what will happen when you take a radiography. See, in a chest example, chest radiography, sternum is overlapping below part. Now you wanted to see something about mediastinum, the sternum will be overlapped. You wanted to avoid such time, or ribs, sometimes rib, a small nodule is there, but rib is overlapping on that. If you wanted to avoid, we need to give angulation to avoid that rib overlapping on the nodule. So that time we will give angulation, that is what is called angulated view. Cowed view, see here in this image, we call 30-degree cowed angulation. Some of the radiography is there, we should give some 30-degree angulation, 40-degree, 45, 50, it depends on the positioning. So 30-degree angulations means, now you can see here is supposed to be X-ray tube in, there is a dotted line supposed to be straight, X-ray tube if it is straight. Now when we give 30-degree and cowed means towards foot. If it is the rays are turning towards the foot means it calls a cowed view. If it is the same thing opposite to this, if it is 30-degree angulation towards head, is called cranial angulation, or we'll call a cranial angulation. So that is what two different angulations will be there. That is manipulated in the X-ray tube. Angulation we will give through the X-ray tube. So these are different terminologies of